The musculoskeletal system consists of bones, muscles, ligaments and tendons. Together, they support the body, protecting internal organs, allowing movement, storing minerals, producing blood cells and producing heat. A fracture is a broken or cracked bone. The cause can be a direct force, for example, a heavy object falling onto the foot, or indirect force, such as falling with an outstretched arm, which may cause a fractured collarbone. There are 3 types of fractures: a closed fracture, where the skin remains intact; an open fracture, where a bone penetrates the skin or a wound leading to the fracture below; a complicated fracture, where damage is caused to another structure or organ, resulting in bleeding, damage to surrounding tissues and blood vessels, pain and shock. A fracture may be suspected if, in addition to pain, swelling and tenderness, there is a snap or crack heard or felt. Also, there may be a loss of function or difficulty in moving the affected part and deformity, such as abnormal twisting or shortening of the limb. When treating a suspected fracture, you should immobilise the site, support in a position that is most comfortable for the casualty, and, if possible, elevate the injured part. This elevation, of course, may not be possible for a leg fracture. The purpose of these management actions is to ease pain, rest the part, and prevent further injury. The first aider may use their hands, clothing, cushions, splints or slings to achieve this. Minimising movement should be the priority. A dislocation is where a bone is displaced out of its position at the joint. A first aider should not attempt to manipulate a dislocation back into place, as further damage could be caused. A dislocation should be supported in the position of most comfort and an ice pack applied around the injured joint. The part should be elevated if possible. Soft tissue injuries include bruising, sprains and strains. Bruising is bleeding into the surrounding tissues, which will characteristically be purple. Over time, it will fade to green and finally yellow. A sprain is overstretching or tearing of a ligament which supports a joint. A strain is overstretching or tearing of a muscle and/or tendon. RICE or RICE is used as a memory prompt to treat all soft tissue injuries. R represents rest, to reduce pain and bleeding. I represents ice, to minimise swelling and ease the pain. C represents compression, to reduce swelling and bleeding. E for elevation, to assist drainage and control the swelling. Soft tissue injuries may require referral to a medical professional for assessment to determine the extent of the injury. Soft tissue injuries will require at least 48 to 72 hours of RICE. If uncertain whether an injury is a soft tissue injury or a fracture, immobilise as for a fracture.